In just 3 days of bed rest, your lumbar discs lose up to 1% of their water content, according to a 2013 study in Spine. Contrary to popular belief, immobility exacerbates back pain. When you sit or lie down for prolonged periods, your intervertebral discs compress and dehydrate. This decreases their ability to absorb shock. Movement, however, stimulates hydration. The act of standing or stretching promotes fluid exchange, akin to squeezing a sponge. When you move, you also engage the multifidus muscles. These small stabilizers are often inactive during sedentary activities. Muscle engagement supports vertebrae alignment. This reduces pressure on the spine. The old adage, lift with your legs, isn't just a safety tip. It's a biomechanical necessity. The erector spinae muscles, running along your spine, generate up to 4 times more force when lifting with improper posture. This excessive force risks microtears in the fascia surrounding these muscles. Fascia, a connective tissue, is highly innervated. Damage here can amplify pain signals. Proper lifting techniques distribute weight evenly across your lower body. They also engage your glutes and quadriceps. These larger muscles are better suited for heavy loads. This reduces strain on your lower back. Stretching your hamstrings doesn't just improve flexibility, it enhances neural signaling efficiency. Tight hamstrings lead to a posterior pelvic tilt, increasing lumbar curvature. This exacerbates lower back discomfort. When you stretch, you activate the Golgi tendon organ. This proprioceptive sensor inhibits excessive muscle contractions. It also facilitates muscle relaxation. Stretching sessions lasting 20-30 seconds can increase range of motion. A 2015 study in the Journal of Physical Therapy Science showed consistent stretching reduced back pain by 18% over 2 weeks. Relaxed muscles place less strain on the spine. Core engagement isn't about washboard abs, it's about spinal stability. The transverse abdominis, a deep core muscle, acts like a corset. It provides support to your lumbar region. Activating this muscle involves drawing your belly button towards your spine. This reduces lumbar vertebrae movement by 30%, as per a study in clinical biomechanics. Planks and pelvic tilts are effective exercises. They enhance core activation without dynamic spinal loading. Over time, stronger core muscles reduce reliance on spinal erectors. This diminishes vertebral compression, alleviating lower back stress. Did you know that walking strengthens your spine? As you walk, the gentle impact stimulates synovial fluid production in your facet joints. This lubrication aids joint mobility. Walking also activates the gluteal muscles, which play a crucial role in pelvic alignment. A misaligned pelvis can increase lumbar stress. Regular walking, even for 30 minutes daily, can enhance circulation. Improved blood flow delivers nutrients to spinal tissues. This supports healing and maintenance. Furthermore, walking prompts endorphin release. These neurotransmitters mitigate pain perception, providing natural relief. Neuromuscular signaling is the unsung hero of pain relief. When you perform movements like bridges or leg raises, you activate motor units in your glutes. Each motor unit consists of a motor neuron and the muscle fibers it innervates. Activation leads to synchronized contractions. This bolsters joint stability. Your brain's motor cortex sends precise electrical signals. These signals prompt neurotransmitter release at neuromuscular junctions. The neurotransmitters facilitate muscle fiber engagement. Consistent practice enhances these pathways, improving muscle control. A 2016 study in Neuroscience Letters found that regular activation reduced pain perception by 25%. Pain is lessened when signals are efficient. Hormonal cascades are activated during exercise. When you engage in aerobic activities, cortisol levels initially rise. Cortisol, a stress hormone, influences inflammation. Over time, exercise regulates cortisol release. This leads to reduced inflammation around lumbar tissues. Concurrently, endorphins increase. These are natural painkillers. A 2019 study in Hormones and Behavior highlighted that endorphin levels rose by 30% post-exercise. This hormonal balance shifts the pain threshold upward. Insulin-like growth factor 1, IGF-1, also gets a boost. It supports muscle repair and growth. This hormonal interplay promotes a pain-free lower back. Connective tissue adaptation is a slow but steady process. Fascia, surrounding muscles, adapts to repeated movements. Microtrauma from exercise induces collagen realignment. Collagen fibers thicken and strengthen. This increases fascia tensile strength. A 2018 study in Journal of Anatomy found fascia remodeling reduced back pain by 15% over 8 weeks. As fascia adapts, it provides better support to muscles. This lessens lumbar strain. Stretching and controlled movements encourage this adaptation. They stimulate fibroblasts, the cells responsible for collagen production. Stronger fascia means a more resilient lower back. Motor unit recruitment isn't static. When you perform exercises like squats or lunges, you recruit multiple muscles. This includes prime movers and stabilizers. Recruitment patterns vary with exercise intensity and complexity. Higher intensity demands more motor units. This increases muscle fiber synchronization. A 2017 study in European Journal of Applied Physiology showed improved recruitment reduced muscle fatigue. Efficient recruitment enhances muscular endurance. It also stabilizes the spine under load. As muscle coordination improves, the risk of lower back strain diminishes. Effective recruitment leads to better support for your spine. Fascia remodeling is an ongoing process. When you engage in exercises like yoga or Pilates, fascial elasticity improves. Fascia contains myofibroblasts. These cells contract, aiding tissue repair. With regular stretching, myofibroblast activity increases. This enhances fascia's elastic properties. A 2020 study in Frontiers in Physiology found this activity reduced lumbar tension by 20%. Improved fascia elasticity allows for greater range of motion. This reduces resistance against muscle movement. Less resistance translates to a decrease in lower back stress. Remodeling fascia contributes to a pain-free lower back. Overtraining can backfire. Excessive exercise elevates cortisol levels chronically. This persistent elevation leads to muscle catabolism. Instead of strengthening, muscle fibers weaken. Elevated cortisol also promotes inflammation. This exacerbates lower back pain. A 2015 study in Journal of Strength and Conditioning Research observed that athletes with high cortisol had a 50% increase in injury risk. Recovery periods are crucial for muscle repair. They allow cortisol levels to normalize. Without adequate rest, connective tissues like ligaments and tendons suffer. They lose elasticity, increasing the risk of strains. Balance between training and recovery is key to a healthy back. Inactivity is equally detrimental. Prolonged periods of sitting shorten hip flexors. This creates an anterior pelvic tilt. Such misalignment places extra stress on the lumbar spine. A 2017 study in American Journal of Preventive Medicine found sedentary behavior increased back pain by 40%. Inactivity reduces blood flow to spinal discs. These discs rely on movement for nutrient exchange. Lack of movement deprives them of essential nutrients. This accelerates degeneration. Incorporating regular movement breaks can counteract these effects. Movement aids in maintaining disc health and alleviating back pain. Avoiding extended immobility benefits your spine. The fitness industry often promotes quick fixes. However, sustainable back health requires understanding biomechanics. A rapid exercise program might neglect specific needs of the lumbar region. A 2018 survey in Journal of Orthopedic and Sports Physical Therapy noted that 60% of responders found long-term relief in tailored exercises. Generic routines may overlook individual postural imbalances. Corrective exercises target these imbalances. They enhance muscle coordination and joint alignment. Understanding how your body moves provides the foundation for effective pain management. This knowledge leads to a personalized approach to exercise. Your back benefits from targeted care, not shortcuts. Chronic training can lead to connective tissue overload. Tendons and ligaments adapt slower than muscles. Repeated high-intensity workouts stress these tissues. Microtears accumulate, increasing injury risk. A 2019 study in clinical biomechanics showed tendon injuries rose by 30% with continuous high-load training. Lack of recovery time disrupts collagen synthesis. Collagen provides structural support to tendons. Insufficient synthesis weakens them. Periodization, alternating training intensities, allows tissues to adapt and strengthen. It minimizes overload and promotes healing. A balanced regimen respects the pace of connective tissue adaptation. This prevents long-term damage to your lower back. A 2021 meta-analysis in pain medicine found that 85% of chronic lower back pain cases had links to muscular imbalance. Frequent misconceptions focus on skeletal alignment, ignoring surrounding musculature. Muscles like the quadratus lumborum and iliopsoas play pivotal roles. When imbalanced, they distort spinal alignment. Addressing muscular asymmetry can reduce pain perception significantly. Corrective exercises realign muscle strength and flexibility. They promote balanced tension across your spine. This highlights the importance of a holistic approach. Understanding muscle dynamics offers a broader perspective on back pain management. The key lies in recognizing the interconnectedness of muscles and bones.